वरुण ये डेड हो रहा है. Your head. Perfect. So generally, how important is causation in prescribing? How important is causation in prescribing? Varun, what do you think?
The possibility of causation of the effects of the causation.
ओके 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 सर आप क्या सोचते हैं?
Position is very important. Reaction to stimulus is also very important.
Yeah.
People react.
ओके ओके आप क्या सोचते हो दोस्त? ओके ओके राहुल आप क्या सोचते हो?
सर इम्पोर्टेंट है एक्यूट एज वेल एज एक्साइटिंग में, एक्यूट के लिए और क्रॉनिक में जो माइनर फंडामेंटल्स।
अनुभव आप क्या सोचते हो?
सर कॉन्जम्पशन इज इम्पोर्टेंट बट साथ साथ जो रिएक्शन है दैट इज मोर।
अदिति okay okay so what happens is so we have acute diseases and we have chronic diseases. Okay generally we've got acute and chronic diseases. It is easier to ascertain the cause in an acute condition vis-a-vis a chronic disease. Okay, and that's why in aphorism 5 of the Organon, Hanuman says, useful to assisting him to cure are the particulars, especially in acute diseases, are the particulars of the most probable exciting cause. Most probable, okay? Because no matter how much you correlate, at best you can only say it seems to be the most probable cause. Okay, so I was recently in Johannesburg and one of my students there. So she was generally discussing a case of one of her family members who went to an Indian joint there. And when they went to an Indian joint, and they had a lot of samosas there. Okay. And so they get all sorts of samosas there in that joint. So they could be pea samosa or a potato samosa. They can also be meat samosa, chicken samosa, and so on and so forth. So she was telling me that, that person had a lot of samosas and after that he started having diarrhea. So she immediately prescribed pulsatilla. Okay, but it did not work because the diarrhea kept on escalating. Okay, so generally she was talking about the patient, so I said, okay, let's see the patient and decide what really happened. So he's a typical, South African who's been there for a long time and not of an Indian lineage. So I generally asked him, I said, okay, are you generally fond of the samosas? So he said, no, I'd had a pretty hectic day in the office and I had a lot of fight with my business partner and I was very stressed. And that was the first food joint there. So I just went and had a lot of it. I said, okay, why did you have a lot of it? He said, because I was really angry. I said, okay. So now what then can be the next probable cause? Anger, which makes the patient overeat. Okay. So I said, okay. And he's a very fit guy, very, very fit, lean guy, probably somebody who will work out a lot. So I said, then do you generally have so much of fried stuff? He said, no, I'm very particular. But that day I was so angry and I just wanted to eat at that point of time. And he said, the surprising part is even with the diarrhea, my appetite is still very high and I'm still eating a lot. I'm eating all wrong stuff. And I go to the bowel and I pass some stool. I feel better for a short while. I lie down. But then I get up because I'm hungry. And then I eat and have an urge again. And again I go and pass stool. And I said, how much of water? He said, I take about three-fourths of a bottle at a time. I take a large quantity, but then I will take it, maybe after 3 hours, I'll take another three-fourths of a liter. I said, this is also unusual because I'm not that extreme a guy. So my appetite's up, my thirst is also large quantity at long interval, and then ailments from overeating. What's the remedy? No, it's briny. It's briny air. Okay. So Sobrania, and then his appetite went down, his thirst went down, and his bowel frequency also completely went away. It didn't require more than the second dose of Briania. So, in acute conditions, at best you can assume this could be the most probable exciting cause. Okay, but as a lot of you said, more than the cause, it is the effect. That effect is what particularly relevant in prescribing more than the cause. Okay, now if this is the cause and this is the effect, if the remedy covers both the effect and the cause, only then is it relevant for prescribing. Okay, sometimes you find a very definite cause, but then the remedy probably has all the effects, but in its pathogenesis you may not find the cause. What would you do in that case? You will still prescribe the remedy which is covering the entire effect. Okay, so cause is important for us. Okay, like for instance, many a times in your clinical practice, now this is acute condition. In chronic, what will happen is people will come and tell you, okay, I once had a severe episode of typhoid, for instance, and thereafter a series of ailments started. Okay, or for instance, you'll find like I recently saw a kid online who developed atopic dermatitis, and the atopic dermatitis started soon after when the kid was about 1.5 months old, and he developed chest congestion, and the mom tried to give him steam. Okay, and ended up burning the child. Okay, and then the burns were treated, and just a few weeks later, as soon as the burns healed with scarring, is when the symptoms of atopic dermatitis evolved. And when we went into the intrauterine history, we could find other aspects relating to causticum as well. So it covered the entire totality, and a few doses of causticum quickly and elaborately relieved the lesions of atopic dermatitis. Otherwise, we all know it's a relapsing remitting condition which can persist for years. Earlier, they used to say that this kind of a disease usually disappears by the end of the first decade of life, but not really anymore because it can persist for long. And now we also identify adult onset of atopic dermatitis. That pattern is also available. So, you have to keep in mind that cause will still be a part, but the effect is a lot more relevant. Okay. Now, for instance, when we talk about causation in Argentum Nitricum, what are the possible causations which will make you think of Argentum Nitricum if the effects agree? What can be causations? Yes. Overthinking or mental exertion. That's it. That's it. So when you are overthinking, okay, or there is undue mental exertion, but will it be a recent phenomena? No, it has to be long continued. So we have another set of remedies where slightest bit of overthinking or mental exertion aggravates the symptoms. Can you think of one remedy?
Bacteria falls.
Sorry? Okay, 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 okay. Not
Calcaria
really.
falls.
So, so remember one, for instance, a very important remedy for this is natrum carb. It's a very important remedy. Okay, first line in Allen's keynotes. Okay, it's a very important remedy. So when you think about Argentum Nitricum, you remember there has to be a long continued mental exertion. Okay, long continued something. And what will be the effect of this long continued mental exertion? The patient appears old, becomes emaciated. Yeah. And where would you find more emaciation? Especially in the lower limbs. Especially in the lower limbs, man. Okay. So remember, Argentum Nitricum is not a remedy for ailments from overexertion. It has to be long continued. Okay. So something which will be there for months and years altogether, and it eventually exhausts him in all possible level. Okay. Okay. What other can be a possible causation for Argentum Nitricum?
Fear. Fear.
Okay. More than fear, it is apprehension. Okay. So apprehension, anticipation, yes. Anticipation. Okay. So that kind of anticipation is what will immediately affect his tummy. Okay. And they end up with a diarrhea. Okay. So there's a patient I remember which I treated long time back, and they said, if it's a kid who was talking about the mom, because the mom and the kid came together, and she said, doc, there's one thing very uh, peculiar about my mom. She's like, if I am stuck somewhere and I'm late, and if my phone battery has died, when I reach home, the first thing my mom will say is, do you know, waiting for you in 2 hours, I've been to the toilet 20 times. So that's the kind of effect of anticipation. Okay. So an excellent remedy for that. What other possible causation can you think of with, sorry? Sweets. Yes. Sweets. Okay. Craving for sweets, but that also causes trouble. Okay. What other effect can you think of? What can be the other possible causations for Argentum Nitricum? Remember sweets, basically the sweets, candies. Yes. What other possible causation can you think of? Any other possible causation you can think of? Yes. Okay. So closed places. Okay, where there is no fresh air coming in, draft of air coming in. So, for instance, if you make them sit in a room like this where the fans are not running, they will not survive. Okay, so closed places where there is no air circulation, there is no direct draft of air. Okay, so even in if it is severe winters, Argentum nitricum, amyl nitrate, medurinum, lachesis, sulfur. These are the remedies would want the doors and windows open in the coldest weather. Okay, so because they always have ailments from close places. What else can be a possible causation? Okay, so remember it's an excellent remedy for ailments from chewing tobacco. Excellent remedy for ailments from chewing tobacco, along with, and we're talking about chewing tobacco, along with arsenicum album. It's one of the topmost remedies in our materia medica. And along with arsenicum, and I've seen that in practice, when you prescribe it to patients who are manifesting the effects of argentum nitricum or arsenicum, not only will it remedy the effects, it also takes away their craving for tobacco, chewing. Okay, it does that. Okay, so in fact, that's something you should see also. For instance, you're prescribing somebody Argentum nitricum who they've got a strong craving for sugar. So as time will go by, their craving for sugar will also mellow down a little. Okay, and when it mellows down, and if they still have symptoms, that's the time when you change your prescription and move on to the next remedy. Okay, so but usually what you'll find is one of the complementary remedies of Argentum nitricum is the one which will still be sensitive to, uh, you know, to apprehensions, anticipation, will be prone to overthink, will be prone to other similar features. So it'll be one of the complementary remedies which will take up that effect. Okay, so let's just read from page number 607. Okay. We also find Argentum nitricum indicated in the troublesome disease gastralgia and neurosis of the stomach, especially indicated in delicate nervous women. The gastralgia is excited by any emotion, by loss of sleep, and frequently at the time of menstruation. There's a feeling in the stomach as though there was a lump there. Can you see that? Are we together?
Yes.
Yeah. वरुण आप सर को हेल्प कर देना, उनको शायद मिल नहीं रहा.
607.
So there's a feeling in the stomach as though there was a lump there. This is sometimes accompanied by gnawing, ulcerated pain referred to the pit of the stomach. From this spot, pains radiate in every direction. These pains seem to increase and decrease gradually, just like under sternum met. Okay. Any other remedy which has pains increasing and decreasing gradually? Platina. Yes. 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 Okay. There is apt to be intense spasm of the muscles in the chest. The patient cannot bear to have a handkerchief approach the mouth as it will cause dyspnea. The patient cannot bear the least food because it makes this pain worse. Sometimes the pain is relieved by bending double and pressing the hand firmly into the stomach. The paroxysms end with vomiting of blurry mucus, which can be drawn into strings, or what is more common, they are accompanied with enormous accumulation of wind. So, Argentum nitricum is one of those remedies where there is eruptions and burping are a constant concomitant. So, there'll always be a lot of eruptions and burping. The patient for a long time cannot belch, but when he does succeed in so doing, the flatus comes in an enormous volume. This is often accompanied with general tremor and a nervous feeling or by a sensation as if head was being squeezed in a vice. So, Argentum nitricum has a lot of sensations. So, for instance, there's sensation as if there is a tightness or a constriction. Okay. Then there is also a sensation as if parts are expanding. Okay. It also has a lot of splinter-like sensations. A lot of splinter-like sensations. Okay. You'll also find a lot of numbness, a sensation of numbness in different places. Okay. The nearest ally to Argentum nitricum here is bismuth, which is indicated in pure nervous gastralgia. The main distinction between it and Argentum nitricum is in the vomiting. So, in bismuth, also there is a lot of anxiety and apprehension. There's a lot of anxiety and apprehension. Okay. Another nervous disease in which Argentum nitricum is indicated is epilepsy. A strong indicating symptom for silver nitrate is this: for days or hours before an attack, the pupils are dilated. After the attack, the patient is very restless and has trembling of the hands. It's especially indicated in epilepsy caused by fright or in that which comes on during the menses. It may also be used in puerperal convulsions when between the attacks the patient is very restless and tossing about, now on one side and now on the other. Argentum nitricum is also indicated in angina pectoris. The patient complains of intense pain in the chest and about the heart. He can hardly breathe. Why can they hardly breathe? Because of that sensation of constriction. Okay, they find it difficult to breathe. And remember, in angina pectoris, the key symptom more than the pain is the sensation of constriction. Okay, or a sense of tightness in the chest, or as if they find there's less room or they can't breathe enough. They complain of all of that. हाँ जी 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 Argentum nitricum is an excellent remedy for purulent ophthalmia, inflammation of the lids or eyes which develop ulcerations or pus. This pus is thick, yellowish, and bland. It's useful in ophthalmia neonatorum where the pus is of the character just mentioned and profuse. Especially is it useful after the failure of pulsatilla or one of the mercuries. So, in many a times, in some of these materia medica, they'll mention that if one remedy fails, and then this is going to help better. What I've seen generally over time, as I've worked with some of my teachers, and I've seen myself, a remedy doesn't work when it is not indicated. So when you say failure of pulsatilla, what I read is if pulsatilla was incorrectly prescribed. Okay, so even in newborn babies, you have to observe very, very carefully and please go through the intrauterine history. Your prescription will be more sorted, okay, more balanced. And what is the marked modality for the eye symptoms of Argentum nitricum? Yes, okay. So it'll be worse in a warm place. They'll be better by cold washing. They'll be better in cold air, in cooler environment. They'll always be there. Okay. You may also use Argentum nitricum in blepharitis where there are thick crusts on the lids, suppuration and induration of tissues. Even the cornea has become affected by continued inflammation. The heat of the fire makes the patient a great deal worse. This symptom you'll also find under mercurius. The larynx suffers from the action of Argentum nitricum. There is mucopurulent sputum seeming to come from the posterior wall of the larynx. There's also marked hoarseness and sometimes even loss of voice. Singers frequently complain of a feeling as if there was something clogging the vocal organs. So both Argentum nitricum and Argentum met have a very strong action on larynx. Okay. Manganum also has similar symptoms, but the most interesting modality of manganum is better by lying down. Okay, it's the most marked modality. Next, I would refer you to the action of Argentum Nitricum on the kidneys, because little attention is paid to this action of the drug. I think it was Dr. Preston of Norristown who used the drug mostly in such cases. He gave it frequently in nephralgia from congestion of kidneys or from the passage of calculi. The face is of a rather dark hue and has a dried up lip. There's dull aching across the smaller tract and also over the region of bladder. The urine burns while passing and the urethra feels swollen. There's sudden urging to urinate. The urine is dark and contains blood or else a deposit of uric acid. Especially useful when cantharis, which it resembles, fails. Okay, so remember, if you are ever prescribing in any renal affection, okay, whether it is a CKD or an acute kidney injury or a UTI, or for instance in ureteric colic, acute. So remember, whenever you have a patient of stone who's got acute ureteric colic, okay, never prescribe an acute remedy. Always take the totality of symptoms and try to prescribe a deep acting remedy. It's going to work way faster than you can imagine. Okay, any disease which is recurring, okay, or relapsing and remitting is always chronic in nature, okay, and it requires a deep acting remedy. Otherwise, the acute symptoms will always lead to a very temporary palliation. A deep acting remedy always works deeper and faster. Okay. In diarrhea, it is very similar to arsenicum. The stools are green and shreddy and consist of blood, slime, and epithelium. There's often discharge of a great deal of fetus and often provoked by the use of sugar. Especially is it indicated when diarrhea follows any excitement such as fright, anticipation of some ordeal, or when the imagination has been played upon. The bowels are apt to move as soon as the least food or drink is taken. In cholera infantum, it is indicated in children who are thin, dried up looking, almost like mummies. The legs are apparently nothing but skin and bones. The stools are green and slimy with noisy flatus and worse at night. So Argentum Nitricum, because of its nature, it was used to cauterize earlier, and those effects were antidoted by Netromure. Okay, so especially it was used to cauterize warts earlier. Nowadays we don't use it, and that's where the effects were antidoted by Netromure. Okay, not anymore, not in the current scenario. So, one very singular symptom to Argentum Nitricum is, especially when it comes to urinary bladder, is urine passes unconsciously day and night. Okay, it's an excellent symptom if the other totality agrees. For all people who, for instance, got cauda equina or any spinal injury or any severe neurological problem, if the symptoms agree, and I've had quite a few cases who have responded really well to Argentum Nitricum, but only if the symptoms agree. So usually in these cases, what I found also, what there was paraplegia and there was loss of bladder control. And not only does it give them back their bladder control, it also brings them the sensation of perception back in the lower extremities, and they're able to walk better, move better, stand up better. Okay. And wherever there's been a lot of disc prolapse, or for instance in cauda equina, where there's too much compression of the nerves, it also has the potential to reverse that prolapse. And with the MRI, you'll be able to see that those changes are also reversed. Okay. So in the next class, we're going to study Argentum Met. Okay.